Hey PAs, you have made it to your emergency medicine rotation of PA school and you are nervous, excited. Maybe this is what you've been going to school for the whole time. You want to make sure not to kill anybody, but you want to put your best foot forward. All these emotions are going through your head, and it's understandable. So today I'm going to give you my top resources to use while on your rotation to help you be more prepared and ultimately treat your patient with better care. So first I'm going to talk about my book resources, and then I'm going to give some apps that I used every single day and really helped me during my rotations. First, to give you some of my background. My background is in emergency medicine. I was a scribe. I was also in orthopedics, so I've kind of been juggling, trying to decide where it was that I wanted to go while in PA school. So my first day comes around. It was exhilarating. I did a Colles, I reduced a Colles fracture, performed a hematoma block, worked with an orthopedic surgeon on a dislocation, got to apply reverse traction for that, handed out dental blocks like candy, pun intended. So nevertheless, it was an exhilarating day, and I really felt that PA school did a good job of preparing, but these resources will help you, especially on your first day and just getting in there. One pro tip I want to include before going into these resources is that I am writing a book. It is going to be covering the gold standard tests and treatments for your diagnoses that you come up with while you're on rotations. What I've found out is that PA school does a really good job of preparing you to walk in a room, come up with your assessment plan, diagnosis, but a lot of times I found myself wondering what the gold standard was for this, or what the exact thing that I should order, without any thrill of what a lot of these other books, provide. So really quick reference. Check out my website. The link should be below if I have got that up yet. If not, just stay tuned. The first book on my top list of resources is Tarascon's Pocket Pharmacopedia. This is the shirt pocket edition. Obviously, if you've been in any kind of medical setting where you're tending or somebody is prescribing medications, you've seen somebody whip this out. There's been countless editions of this thing, and basically it is the gold standard of dosaging and looking up quick reference of pretty much any medication. It's great for dosaging, and it gives you a pretty quick synopsis of that medication. Very good book here. Next, this is EMRA's Antibiotic Guide. I've got the 17th edition. A lot of EM groups will give their new residents or anybody coming on, they'll give them this book. This is a fantastic antibiotic guide. Into major body systems such as ENT, GI, but it also goes into environmental exposures, pediatric infections, and things like that. It's a very quick guide. So say you have a patient come in and you're worried about something dermatology. So if we have Bartholin cyst and abscess, it's going to give me quick pearls on the management. It's going to give me the most common organisms, polymicrobial, E. coli, Staph aureus, and then the plan of how you're gonna your management plan. So this is really good, especially if you have a proactive preceptor, somebody who's gonna pimp you. This gives you a quick guide to the management and also some of the common questions that you might get pimped on. Check this out. Next book, EM Fundamentals. Notice all of mine are like pretty small here, because I'm literally, you carry these in your little bag, whatever you bring to your rotation. EM Fundamentals. This is an essential handbook for emergency medicine residents. I believe this book was actually written by emergency medicine residents and then proofread or resourced out to different, I think this was in the Michigan College of Medicine, resourced out to be reviewed by their preceptors, by their attendings. So this is a very comprehensive book. It is divided into chief complaints. It's coming in with altered mental status or delirium, and you suspect sepsis. Go straight to sepsis. It's going to give you a pretty comprehensive but succinct guide to how to manage and how to go about the care of that patient. So it's going to give you, again, some more. It's going to give you quick pearls, their temperature, heart rate, white blood cell count, sepsis protocol, the high yield history, exams, diagnostics that you need to order, and then the management. So, and also went into fluid resuscitation on this. So one pro tip, I just thought about this, is that when you're going to your into your rotation, this really goes for any rotation, but especially emergency medicine, what I would suggest is every morning when you get there, clean off your station, get there a little early, clean off your station, because you never know what's all been there before. And I'm a little bit of a germaphobe. And set up your books, set up your little nook, the little nook they've given you. And I would set everything up, and so when I'm seeing patients going back and forth, I'm able to come back, grab my antibiotic guide, look it up real quick, and keep it moving. All right, next resource, we're going to get into some phone apps. These will be pretty quick, but I'll put the description down below. Epocrates, this is a medication app. I believe it's free. I just used it to look up dosaging of medications. If I heard my attending use a medication that I've never heard of or seen or something, I might quick look in Epocrates. Oh yeah, that's the brand name, something like that. MDCalc. This was a fantastic app I learned on this rotation, and this is an app that you can put in basically the rule out criteria, like your PERC or Ottawa for ankle sprains, or what we have, PCARNs, pediatric, things like that. You can use this for heart scores, Wells criteria. It's basically an amalgam of all of the quick rule out, high sensitivity, high yield exam tests. Very good app. Lastly is FP Notebook. This is actually family practice notebook, but I use this probably more than any app that I used on my phone. It's really for family practice, but it can transcend into other things. The app is divided into cardiovascular, dentistry, endocrinology, GI, and basically anytime you have a person that comes in one of the categories, you click on it, or you can even search their diagnosis, and it brings up the assessment plan, and it's got its own way of going about things. Take a look at that app. Okay, lastly, my last pro tip I've got is if you are going to ER or even another rotation, take a look at the white coat clipboard. This is a white coat clipboard. It flips in and out. It opens up so that when you're going from patient room to patient room, you can keep tabs, and you keep a little notepad with you. It fits right in your pocket, and it has all the tests, all the CBCs, CMPs. You can actually even customize it. It's got the normal axis deviation things. It's got a lot of kind of stuff there. So that's another pro tip. My last tip is to get you a printout of your SOAP note. So for me, I used a chart layout that I'd used as a scribe, because that's what I was used to. And it was basically a very quick patient chart, but it was all blank, and I was able to pretty much on the first day walk in and go patient to patient and keep log of everything I'm doing. So that is all I have for today. If you haven't as of yet, hit the subscribe button. That lets me know that this channel is actually helping some people, and that's really what this is all about. If you have any questions, please feel free to comment now, like the video, and if you would like to request any video topics that you would like covered, again, leave a comment or email me. It should be down there in the notes.